Good afternoon. I want to kind of go over a brief introduction to structural family therapy. When it comes to structural family therapy, the major contributor is Dr. Salvador Menchuchin. And Dr. Menchuchin is credited to be, like I said, the most major theorist in this school of structural family therapy. He was born to Russian Jewish immigrants in Argentina, and he completed a medical degree in Argentina and later joined the Israeli army. And he was there for like 18 to 20 months, and he also studied here in Chicago, so got a personal kind of connection to him. Um, well, after he got out of the Israeli army, he became the medical director of the Whitwell School in New York. And in that school, he dealt with minority youth. So that's how he kind of formed his theoretical approach of structural family system. Um, One of the underlying premises of this theoretical approach is that every family has a family structure. And Dr. Mnuchin defined that structure as an invisible set of functional demands that organize the ways in which family members interact. And so each family member reveals its structure only when it is active and is able to see repeated interaction patterns between family members. There are some families, according to Dr. Mnuchin, who may have a great deal of structure, so that the family is organized in a hierarchical fashion, and members relate to each other in an organized way. It's very hierarchical. The parent, the children, is like everything is kind of laid out in the structure. However, Dr. Mnuchin also says that some families have very little organization and few opportunities are provided for members to interact with each other. So families sometimes have an open and appropriate structure, according to Dr. Mnuchin, are able to deal with stressful family events and recover from them much quicker than those that are disorganized. Okay. So some of the key components to um, structural family therapy is what Dr. Mnuchin called coalition. Dr. Mnuchin found that individuals uh, within the family system form coalitions. And a coalition can be defined as an alliance between family members against a third member. So it's kind of similar to what we talked about in triangulation. But a stable coalition is fixed as between a mother and a daughter that becomes an essential part of the family everyday function. A detouring correlation refers to one in which a family pair holds a third family member responsible for their difficulties or conflict with one another. Okay. So it could be a mother daughter, a father son, it could be a father daughter, but they have a fixed correlation and it's essential to everyday family. So it gets together and it forms this bond. And usually a detouring correlation is when that bond, that family bond, that pair hold the third family member as the outsider, as the scapegoat, the difficult child, and the responsible for any kind of conflicts they have. Okay. Then you get into what Dr. Mnuchin called in framework subsystems. In this Dr. Mnuchin said that families rather than individuals are the client. So that's kind of like the theme when it comes to family systems counseling. The family, not the individual, is the client. So even if the individual is part of it and that's the presenting problem because the coalition identified them, Dr. Mnuchin felt that, okay, fine, but it's the families that's the issue. We got to deal with the family. So the family symptoms are best understood in the transaction patterns of the family. So the family can have these subsystems and exist to carry out different family tasks. So Dr. Mnuchin considered the spousal, parental, and sibling subsystem as having the most influence in the family. Okay. Um, the spousal subsystem consists of the husband and wife. And I know taking consideration that this theory was originally created in the mid 70s. So it's like now, you know, you look at the whole, patriarchal system of the husband and wife, you also got to look at now is like if you're going to be looking at the structural family therapy, a structural family therapist of the day wouldn't, limit it to just the husband and wife. They'll look at it as, you partners, same sex partners. They'll look at it to where it's like single family homes. They'll look at it like, that. So it's like, but for this, to try to explain this theory, I'm just going to look at it in the traditional so-called patriarchal white power structure as far as supremacy, nuclear family. That's what Dr. Mnuchin felt was the best, unfortunately, or fortunately, I don't know. But at the time, you look at it in the context of the time. So the husband and wife, when both spouses nurture and support each other, he felt the family functioned quite well. Um, and like I said, he is really old school. So he looked at it to where an example of the husband and wife supporting each other was like um, the husband and wife may organize family life, such as the husband or the man goes out and decide do all the outside work, the lawn, the backyard, the so-called stereotypical traditional male household duties, and the wife completed all the work on the inside of the house, like the cooking and cleaning the house, my work, uh, the traditional stereotypical female um, roles as far as upkeep of the home. So it's like Dr. Mnuchin felt that kind of system worked best when dealing with bonding a family. When it came to the parental subsystem, it's composed of those responsible for the care, the protection, and the socialization of the children. Um, I guess you could say a universal tenet of structural family theory is the belief that a cohesive, collaborative parental subsystem is critical for healthy family functioning, according to a structural family therapist. So Dr. Mnuchin considered a family healthy if the parental subsystem did not operate in cross-generational fashion. The third subsystem is the sibling subsystem, which consists of the siblings, the brothers and sisters, right? And siblings who are 3 to 4 years apart usually form this subsystem, according to Dr. Mnuchin. So it's like, so when you look at a large age difference, Dr. Mnuchin felt that they were unlikely to form a sibling subsystem. So he felt that the sibling subsystem was usually to help brothers and sisters deal with the parents. Okay. Uh, Boundaries and family mapping in structural uh, family therapy. Bowen, what we discussed earlier, used genograms to represent intergenerational patterns of relating. Mnuchin used boundary diagrams to explore the current ways in which families related to members. Boundaries, according to Dr. Mnuchin and family structural system, is defined as the physical and psychological factors that separate family members from one another. Um, According to Dr. Mnuchin, for proper family functioning, the boundaries of the subsystem must be clear. So, um, get a pen here. Structural family therapists use mapping systems that have broken, solid, or dotted lines to represent the strength of boundaries. Okay, so like a clear boundary are represented by broken horizontal lines. Okay, hopefully you can see that, right? So they're broken horizontal lines. Clear boundaries are composed of rules and habits that permit family members to engage their relationship with other members within the family, and they encourage communication between them. In family with clear boundaries, only one family member may be permitted to speak at a time. Okay. Rigid boundaries are represented by a solid line. Okay. Okay. And with rigid boundaries, they're usually inflexible, keep family members away from each other. Family members find it hard to relate to each other in intimate ways. Usually, members become like emotionally detached and cut off from each other, right? And then the final one is the diffuse boundaries are represented by um, the dotted line, okay? And the dotted line, so they're represented by the dotted line, right? So this one will be the clear, will be broken horizontal lines. This will be the rigid, right? And then the diffuse would be the dotted lines. I hate writing number for this. It's an S. It's an S, not a R. Okay. Um, and usually in a diffuse relationship, there's um there's not enough separation between the family members, and some family members may become fused together, whereas clear boundaries create independence and autonomy within people. Diffuse boundaries encourage dependence. Okay. Um, then you have the rules, and the power structure in structural family therapy. Um, so besides the structure, the subsystems, and the boundaries, structural family therapy is founded on roles, rules, and power, right? And usually, structural family therapists need to understand the various roles within which a family operates. So you have like some families have a role for the eldest son, or the youngest. The baby of the family may not be taken seriously, even though they are well into their 30s, 40s, or 50s. Okay. Um, Rules in the family may be explicit or they may be implicit. Rules usually provide the family with their structure. So functional families have explicit rules, excuse me, that everyone knows and understands. Um, a family rule may be not to talking with outsiders, like a rule of secrecy regarding on what a person may have done. Or rules help organize the family life because they make life more predictable. When it comes to the power structure, it usually refers to the ability of a family member to get certain things accomplished. Um, the person who is the power in the family often makes most of the family decisions. Um, a structural family therapist um, usually look at a dysfunctional family where the power is typically invested in one or two people. So very few family members have any input in making decisions. The structural therapist investigate how power is distributed in the family and how they assist family members in finding new ways to distribute power so that each person within the family, each member, has some power. Um, when it comes to the therapeutic process of structural family therapy, um, one of the things you got to look at is goals, roles of the structural therapist, and phases of structural therapy, and then techniques. Okay, so one of the goals of family therapy is structural family therapists make hypotheses about the structure of the family and the nature of the problem. So we're structural family therapists, we'll establish goals for change. So the structural family therapists work with families that help change conditions and alliances to affect change in the family. Um, we help family members establish boundaries with members of the family so that they are neither too rigid or too infused. Um, they, the therapists, support the family subsystem as the decision making system that's responsible for the entire family. Another goal is to help the family deal with issues of power and how it's distributed. So the structural family therapists assert that problems are maintained by dysfunctional family structures. The goal of the therapy is structural change of the family. So the belief that the family problems are embedded in dysfunctional family structures um, has strongly been criticized by, okay? So let's look at the role of a structural family therapist. A good structural therapists are both the observers and the active interventionists. Okay. So they observe and then they actively intervene. So the role of the structural family therapist changes during the course of the therapy. So as the therapy, develop and become more enhanced, the role of the structural family therapist will change. So in the first phase of the therapy, the therapist joins the family and assumes a leadership position. Okay. Um, During the second phase, the therapist mentally maps out the family's underlying structures. And in the final phase, the therapist helps the family restructure itself. Um, Usually, an underlying premise is that the therapist has an accurate interpretation of what is taking place within the family, and they have powerful techniques to help the family. So the family therapist using structural is usually very active in when using structural family therapists. Okay. Um, some of the techniques that are used is like punctuation. Punctuation, right? So with punctuation, catch my breath there for a second. Punctuation is considered a selective description of a transaction in accordance with uh, the therapist's goals. So, if, let's say, for example, if a parent is having difficulty showing affection toward their child, um, when the child is hugged spontaneously by that parent, the the therapist might uh, talk about how that used as a compliment, uh, uses compliment and competent, and the therapist punctuates a therapy session by changing the perception of everyone involved. The therapist punctuation increases the possibility of family members develop new competencies in the future. So it's like with the example of the parent is showing difficulty showing affection toward their child. So it's like you encourage the parent to show the child affection spontaneously. So it's like when the therapist um, might say that the parent is being competent, okay, and that's the punctuation, the selective description of a transaction. So it's like when they do that, you kind of let them know that that's good, that that's what's happening, and it help the competencies in the future. Unbalancing a system or ally within a subsystem takes place when the therapist support either an individual or support the system against the rest of the family. So, an example of this is like a therapist might sit next to the wife who is being accused of being very bossy in the family. So, while the mother might be sitting next to the daughter, the therapist can take up for the mother and give reasons why it's important for the mother to change her behavior. Okay. Usually, with the therapist position, family member responds differently to the mother because the therapist take a leadership role. So this usually work well when a family member is considered the the black sheep of the family, okay, and needs support to develop a new role. So if the mother or the father is too bossy, the therapist would like sit next to the to the to the mother and give reasons why it's important for the mother to change her behavior. Okay. Um and this usually helped by because of the role that the family therapist uses and takes in when dealing with the family. Um Enactment takes place when the therapist invite the system members to interact directly with each other. Okay. Example of this is that a family member or a family has a heated argument on Friday night, and it's about which movie they're going to order, and they might be asked by the therapist to have a heated argument in front of them. The goal is to see how family members interact with one another and provide them with a means to change their existing patterns and rules. So, usually during the enactment, family members experience their own transactions and the family members in a state of heightened awareness. So, it's like you, as a structural family therapist, you might encourage them to reenact the argument so you can see how each member kind of interacts with the other members. And so that way you can change certain patterns and rules that's going on. And say you notice that this is happening whenever this, whenever this family member does this, or you're very, you like to really put this person down and insult this person. So you get the chance to actually see it play out, right? Um, then there's boundary making, is another technique used in structural family therapy. And what boundary making is um, a boundary is an invisible line that separates people within or a subsystem from one another. And all families and individuals need boundaries. Okay, and families also go through various stages of development, such as the childbearing stage, the empty nest stage, the grandparenting stage. But each of these stages brings demands, forcing the family members to accommodate to new needs as family members grow or age and circumstances change. When children are young, families may need more rigid boundaries to make sure that the children stay safe and are taken care of in a responsible way. Um, when the children are teenagers, the family boundaries may have to become more flexible to meet the needs and demands of different schedules. Part of the therapeutic task is to help the family define, redefine, or change the boundaries within the family. So the therapist also helps the family to either strengthen or loosen the boundary depending upon the family situation, right? Then there's restructuring, and what restructuring is a very critical technique in structural family therapy, and it's the process of changing the family structure through enactments, delegating the looking at the boundaries, unbalancing by forming a coalition with some family members against another family member, and Dr. Mnuchin developed the family lunch technique, this family lunch. And Dr. Mnuchin developed the family lunch technique for working with anorexic families. And in this, the therapist eats with the family and it acts the parent's effort to make the anorexic person eats. Okay. Um, so the final technique that's used in structural family therapy is considered diagnosing, and is considered identifying client symptoms, the family symptoms, as an expression of the transaction patterns affecting the whole family. So in this, the structural family therapist, okay, so um, the diagnoses are found in observations that are made in the first sessions and during later sessions the diagnosis refined and reformulated. Okay, so let's look at summarize some of the key concepts and things of structural family therapy. One, the family is treated as a system or a subsystem, but individual family members are not ignored. Two, family functioning involves family structure, subsystems, and boundaries. Family structure, three, family structures is an invisible set of functional demands or rules that organize the manner in which family members relate to one another. Four, um, you observe the family members to see the family structure. Six, I'm trying to remember the numbers on the six. Um, you focus in on the family interaction to understand um, the family structure or the family organization. Um, Another key point is that family member symptoms are a result of structural failings in the family. Structural change must take place in a family before a family member's symptoms can be reduced or addressed successfully. Focus on how, when, and to whom family members relate. Who says to whom, right? So, who says what to whom? In what manner do they say it? And what outcome? Family subsystems, including the parental family subsystem, um, the sibling subsystem, and the extended subsystem, would include the grandparents and other relatives. Um, Family members play a different role in each of the subsystems in which they belong. Structural difficulties or problems occur when one subsystem take over or intrudes on another subsystem. Boundaries are emotional barriers that protect and enhance the integrity of individuals, subsystems, and families. And there are extremes in boundary settings. Problematic family structures have boundaries that are rigid or diffuse, and subsystems that have adapted inappropriate tasks and functions. Enmeshment is where one family member becomes overly involved in another family member's life, and enmeshment promotes dependency on parents. And clear, healthy boundaries help individuals attain a sense of personal identity where you can still have the person retaining a sense of belonging in a family system. When you're doing the treatment process, summarize that up, is you engage the family as a unit and affect structural change by one, joining the family in a position of leadership, two, mapping its underlying structure, and finally, three, intervening in ways that change and transform an ineffective family structure. And the treatment process challenges rigid family transactions patterns, and the therapist consists of the therapist pushing for clear family boundaries and increasing the amount of flexibility in family interactions. The goal of treatment, one of the goals of treatment is to bring out into open problematic behavior so that the therapist can see and help change such behavior, kind of reduce symptoms of dysfunction. Another goal is to bring about change in family structure that has supported family members' dysfunction or disordered behavior. Um, some of the roles of the therapists include the therapist mentally mapping their families and work actively in therapy sessions. They instruct families to interact through enactments, and therapists function as directors and coaches. The therapist brings about structural change in the family by one, modifying the family transactional rules, two, developing more appropriate boundaries, and finally, three, creating an effective hierarchical structure. Some of the treatment techniques, structural family therapy is joining, build and sustain a positive therapeutic alliance with family members. The family mapping, draw a map to identify family boundaries and different interpersonal transaction styles. Enactments, the family participate in a conflict situation and it would take place at home so the therapist can understand the problem. Restructuring, change the structure of the family to make the family more functional. Unbalancing, therapeutically ally with a subsystem within the family. And that way the therapist supports a subsystem and this support unbalances the family and making boundaries. And these are usually the physical and psychological factors that separate people from one another. Some of the key limitations of structural family therapy. Structural family therapy was initially developed for low social economic status families. To feminists and some critical race theorists have claimed that the theory promotes gender stereotyping by emphasizing traditional parental roles. Um, and the theory is weak in explaining family dynamics and development. And the distinction between structural family therapy and strategic family therapy is very blurred, and they appear to be very, in a lot of ways, they're very, very similar. Okay, so that would kind of sum up um, the structural family therapy, and like I said, we'll get more in depth and involved, and you'll be interacting when we start having our panelists come in and talk, and then you'll be able to see, like when you listen to some of their stories, how the different theories can like be used for different things. So it's like hopefully the panelist discussion, you'll be able to see like how these theories can be implemented you through different cultural, or whether they can be. And so like after the panel, then we can discuss like how well would these theories work with these type of situations, on how the culture kind of informed and developed the family roles and the family functioning. Okay, so please stay safe, and I will um, talk to you later.